process
Okay.
work?
The process, it's a process, but there's no waiting list, so that's a good thing. It's about a 45 to 60 day time frame. People, view that and go, ooh, but other services, it might be 6 to 10 months of waiting. The process is relatively easy. You don't have to have a doctor's referral. You simply call up and talk to our intake coordinator, and then she does the phone screening. She looks at those eligibility requirements. From that point, if they've passed that, then we have a nurse and social worker go out to the person's home and do an in-home assessment. They look at the financials. Is the person on Medicare or Medicaid yet? If they're not, our social worker can assist them with the Medicaid application process. They look at the safety of the home. Are home modifications required? Do they need a bath bar put in, a shower chair? And then they look at that nursing facility level of care. They look at what are the needs of this person. Does this person have a chronic medical condition? Are they having problems with dementia? What are the impairments that would allow this person to come into the program? Once they've made it through that process, then we have them come in and they sit down with the interdisciplinary team, each discipline, which it's the primary care physician, nurse practitioner, social workers, the nursing staff, the dietitian. It's that whole care team of people. And they create a care plan with the person. It's person-centered health care. Caregivers also come in because they have their input as to what they want this person to receive. And then the person, once they're approved, they start receiving services on the 1st of the next month. So if they're eligible on October 2nd, they wouldn't start receiving services until November 1st. And then they're covered from the time they enroll to end of life. So everything and anything a person needs is provided. For caregivers, this is huge because the burden is off of them with having to take care of all of these things because we're doing it for this person. And they also receive extra services that, with the recent Medicaid cuts to vision, dental, podiatry, audiology, chiropractic care, we still provide all of those services. And we're funded through Medicare and Medicaid. We get what is called a capitated amount. It's a fixed amount per person per month that we get, and it goes into a pool of funds, and we manage the money. We're the ones that decide how this money is spent. And so we're able to provide those services like dental and vision, podiatry. So even if a person's on Medicaid, in a PACE program, they still receive all of those services.
Now, all those extra services you just talked about, are they available then on site also, or do they get sent off to a doctor or a dentist?
Those are on site. We have
Okay.
basically a mobile dentist and traveling podiatrist, and they come right on site to our health clinic and provide those services.
The other intriguing thing for me was I walked outside and was leaving, and there were the rapid, I think they were rapid
Hope Network.
Hope Network
Yes.
buses. Now, so somebody coordinates if somebody's unable to drive, which probably is common.
All the medical transportation is provided. So we have a transportation coordinator that gets everybody where they need to go. They get picked up from their home, they get brought to Care Resources, and if they have to go out to the community to see one of the specialists, then the bus can pick them up and take them to those appointments as well.
So you really are a one-stop.
We are. And for seniors, transportation is a huge issue, and this is one of those pieces that we're able to solve for them.
You had one story that you told me when we were doing the tour about somebody in driving and getting picked up, and tell that story.
It's a woman who came into our program. She'd been in a wheelchair for about 2 years, and her son found out about Care Resources and the PACE program and got her enrolled, and with intense physical therapy, after being in a wheelchair for 2 years, she was able to walk again. And she lives with her elderly husband, and during that time frame when she was in a wheelchair, wasn't able to leave her home because he couldn't get her in and out of the car, and so she was very isolated. And after coming in and getting the physical therapy and starting to walk again, she's now able to get out in the community, and she said her favorite activity is going for a car ride because it was something she'd lost, and now she's got that back, and so she said she just loves getting out and just going in the car. And so we have a lot of success stories like that.
Right.
It's fantastic to see that.
And that was, I know it was just one of many, but again, to me, it's kind of this PACE program has complemented what we tend to do, I think, fairly well in Kent County. Just talking about the 145, I don't know what you called them, people that help support their providers, I think you had mentioned.
The providers?
I mean, just that the coordination of activities that you don't even have employees really. They're just they're coming from these other organizations. So you didn't recreate any administrations and all of that. That just to me is just was one of these kind of eye-catching and
it's a very innovative model that we have set up. We actually are, of the 69 PACE organizations in the country, we are the only one that's set up this way where we have the 5 community partners. Each one is tweaked a little bit differently. We all run the underlying PACE program, but each organization is independent of one another. But it's very innovative, and people often ask, how does this fit into healthcare reform? Well, I say this is healthcare reform.
Yeah. Mm-hmm. No, it is, I think for folks who are really, they're questioning, do they have to kind of give up everything and, go and go into a nursing home or whatever. I know a lot of folks move into condos and they transition into the, there's this continuum of care, and then they move through that process. I think this is going to be one of those really services into the future that I think more and more people are going to just jump into, because it's to be able to stay in your home. I think those are the 2 biggest things I hear about is my driving. I want to be able to drive, and I want to be able to stay in my home. It's that independence that we all have had all of our lives. And so you're really trying to complement that and really trying to help people keep that independence in that process, which is, I think, fabulous.
Yeah.
So.
And that's why this program has just grown so much over the past 5 years. The number of PACE organizations has doubled. There are 5 more that are set to open in 2010. They're averaging 4 PACE organizations a year. Within Michigan, Ottawa County is the next county that PACE services will be available in. Care Resources and Life Circles in Muskegon County will be sharing that county and providing the services, so that's next. And we've been talking to other areas of Michigan, trying to figure out how we can get this into more areas and provide the service for more people.
Well, I think when people come and see it, and they see the opportunity for a family member, themselves, whatever, I just think that's what will sell it, and it doesn't need to be sold. But I think people need to hear about it and find out what's going on.
Yeah.
You do have other activities that happen. You have town hall meetings. You talked about some of the activities that you do. There's a social, piece to this. Are folks allowed to bring friends along? Is that the kind of thing that if somebody said, "Hey, you've got to come and see this," can somebody come and visit just to see what's going on?
Yeah, we do tours all the time. Starting in January, we'll have regular Lunch and Learn series. People, they really get it, I think, when they come in and see it, because they see how everything is coming together. They see the buses dropping the participants off, taking them home. They see the pharmacy. They see the recreational day center. They see all the activities that are taking place. And they see the happy people. I mean, that's the biggest thing. And so, yeah, there's the activities for participants. We recommend that they come in at least once a week because they get their prescriptions on a weekly basis. We also get to know them on a very personal level. It's not a model where a person sees their doctor once every 6 months, they get a 5-minute exam and they're out the door. We want to get to know them on a personal level. And then we want to be proactive. If we notice that they're getting a little bit wobbly, we can implement physical therapy before they take that fall, because if they take that fall, we've got a much bigger problem on our hands. And so the way that we're funded with getting that capitated amount going into the pool of funds, we can have physical therapy go on indefinitely. There's no benefit limitations. So if that's what it takes to keep a person sustained at that level of health, we'll have physical therapy continue indefinitely. And so they get their physical therapy on that trip into our day center. Some people come once a week, some people come 5 days a week. It just depends on the person's care plan. Caregivers that work full-time may need their loved one in a safe environment when they're at work, and so they'll have that person come 5 days a week. And so it's very individualized for each person. Oftentimes I get the question of, well, what's the downside to this? This sounds so good. There's got to be some catch. Well, it's about perspective. The biggest challenge for people is that they do have to give up their primary care physician and lock into our network of providers. Some people go, oh, you know what, I don't care. This is so good, it doesn't matter to me. Other people, they have to give up that trust. And it can be hard. They've had that same doctor for 20, 30 years, and to give that over to somebody else can be a challenge for people. They lock into our network of providers. We have 175 different specialists and home care agencies and medical supply companies that we work with, and as long as they stay within that network of providers, they don't pay for any of the services. If they go outside of that network, then they would be liable, except if it was an emergency. If they needed to call an ambulance and get to a hospital, then that would, the hospital that is nearest to them would provide the services, and there would be no cost to them.